everyone. Here we are with Dr. Toni O'Hara and the infamous Baxter the dog. And this is part 2 of fleas and ticks. With spring coming around the corner, lots of people have questions. In fact, with talking with Dr. O'Hara, fleas and ticks are some of the questions that are really on people's mind. It's what they want to know most about. So we are going to talk about tick and tick prevention today, and Baxter will be our demo dog. Can you please give me a little information about ticks and maybe ticks in New England?
Yeah, so basically we have several different species of tick that are active in New England, and we're, technically in southern Maine, and around the Cumberland County area it's endemic. We have ticks everywhere. They're notorious for being in long, tall grass and in the woods, but technically anywhere where there's trees and grass, you're really going to be careful about fleas and ticks. And this time of year, when it's snowy and cold, their activity is a lot less, but you're never safe. I would never drop my guard about ticks, especially if I'm going in the woods, because even if we have a warm day and the snow melts, they'll come right back out again. So definitely recommend treating year-round where we are, even though it's hard to believe, but I've definitely pulled ticks off of dogs in January before, so it depends on the weather.
Oh, as a dog owner, that really stinks.
Yeah.
To think that in the winter on warm days that they're that active already.
It could. I mean, as a rule of thumb, if we have bare ground, you need to be protecting your dog. So it's a good rule of thumb.
So you said tall grasses. So tick transmission, how does it happen? How do they actually get onto your dog?
So some people think that they can jump, but there's been some back and forth about it. But what we know is that usually what happens is when the dog is walking through either the woods or the grass, the tick is up high, and as the dog brushes by them, they cling onto the fur, and then they start scrambling down to the skin. So
got it. Yeah, I the idea of a flying tick is really scary.
I know. Yeah, hopefully they don't learn to jump. That would be.
So how should I check my dog for ticks? Like short-haired dogs, you can probably see them, but someone like Baxter or even a dark dog, is there a way that how would you check Baxter for ticks?
So what I usually do, I do a lot of running in the woods with him. So whenever we come home, before I go in the house, I've got a towel set aside, both for mud, but also just the action of kind of wiping him down would hopefully get any tick that might be just kind of crawling on his coat. And then I just, I roll him over, just go over everywhere. You're never going to find them all. I mean, that's a given, but you can definitely, find a lot of them if you do a good, just once over kind of. You'll often find them face and muzzle area, but also, sometimes on the feet. They can technically be anywhere, but I often will find them certainly, down on the legs and sides too. But just gotta do a good thorough check, no matter what your dog's hair coat. But you've also got to be aware that you're never gonna find them all.
Yeah, you and I had talked about that last week. Some people will say, oh gosh, my dog never gets tick bites. Mm-hmm. And you're saying that's just not true.
Not true, and it's a classic comment from a lot of people right before we diagnose something like Lyme disease or anaplasmosis, unfortunately, and it's just, you just can't find them all.
So your dog has had a tick bite, and you, before that, how your dog gets a tick bite, you see the tick. I've heard so many wives' tales about like set the tick on fire. What is in your opinion, the best way to remove a tick that has already burrowed into your dog or cat?
So I like to use something called a tick twister. It's a good way of it basically like hooks underneath, and then you twist it, and they because you have to twist their mouth parts out, and they'll usually let go when you twist them. And then it will still be alive, and then you just need to kill it, like either by squashing it, or you can set it on fire if that's your thing, flush it down the toilet, whatever you want to do. Or you can hang on to it for us and bring it in, and we can identify it for you too.
That's great, because I know sometimes when I see a tick, I am not sure what type it is, but I will actually add pictures of that to my blog posts, different pictures of ticks.
Yeah.
So your dog has been bitten by a tick. You didn't get it out on time, and you're starting to notice some symptoms. What are some of the symptoms and then infections that come from tick bites?
So what a lot of people notice is where the tick bit, there's usually a raised hard lump, because they cause quite a marked reaction, and then there's usually like a little spot where the mouth parts have been in. And we don't usually worry about that too much. Even if accidentally a few mouth parts were left behind, they'll work themselves out. We don't get overly concerned about mouth parts and the actual bite itself. And dogs don't usually get the target lesion like people do, so that doesn't really help us kind of determine what kind of tick it was or if we need to be worried about Lyme. Ultimately, symptoms are usually fever, lethargy, inappetence, sore, swollen joints, so they usually will walk like they're on eggshells, hobbling around. And some dogs just can't even get up because they're just so sore. Unfortunately, a lot of dogs have no symptoms at all, which is probably the majority of dogs. So we have to base our treatment plan and how we approach things case by case basis, basically, and risk factors and things. But we know from research that even if they don't show symptoms, they can get sick later on. They can certainly be more prone to getting kidney damage and things like that. So we take it very seriously.
Okay. So with that said, what are the sort of the big infections that people get on the East Coast, like Lyme disease and the other ones you'd mentioned to me?
Yeah, so we usually do an annual 40X test, which checks for, it checks for heartworm, but it also checks for 3 common tick illnesses: Lyme, Anaplasma, and Ehrlichia. Those are the most common in our area. You can also see Rocky Mountain spotted fever and a few other types as well. They're a little bit more exotic to our area right now, but the way things are changing, we could start to see more tick illnesses in the future, certainly.
This is just a curious. If you finally get the tick off your dog, is putting alcohol on it or something right after the bite, you pulled it off, can that help stop something like Lyme?
No, unfortunately, once they've exchanged a blood meal, you can't do anything retroactively. Your best bet is to protect your dog before they bite, basically. So.
Okay.
But yeah, I mean, as far as like, medical management of the bite itself to soothe it, you could do a little bit of alcohol might sting, but you could do some Neosporin, triple antibiotic cream, or a 50-50 dilute hydrogen peroxide solution is a good cleanser.
And the teeny itty bitty ones, those are the deer ticks. Those are really hard to see, aren't they?
They can be. When they're in their their nymph stages, they can be almost microscopic. So it's pretty scary how tiny they are. Those are the ones I worry about the most because, it's nearly impossible to see them sometimes. Yeah, especially on cats and things.
Tick prevention. What medication should you give your pet for ticks?
So the flea products that we talked about before are the ones that we usually use for ticks as well. I think by far my preferred product is the Simparica. It's a monthly product. It has been proven over the years to have an excellent speed of kill for the ticks, and it's safe and effective for almost all dogs. I mean, unfortunately, there'll be the rare case of a dog that just doesn't react to it well. And certainly any patients that are prone to seizures or have epilepsy, unfortunately, can't take those products. But in general, when it's used at the appropriate dose, it's a very safe, effective product, and in my opinion, has saved my dogs from getting Lyme disease for the last 5 years. So I've been really happy about I've both used Bravecto and the Simparica on my dogs over the years, and been really happy with how they work, because the way that they work is that they the tick gets the product when they bite, but what's happening is they're killing the tick very quickly, and so it's hard for them to give Lyme disease because they need about 24 hours attachment to give Lyme. Anaplasma is more difficult. They can give anaplasma a lot quicker. So even on the good products, we still are diagnosing some anaplasmosis. But since we've been using the chewable products, much less Lyme disease, which is great.
That is great.
Yeah.
And then if they do test positive for Lyme, what is the protocol after that?
So it's definitely a gray area. It's one of those things you ask 10 different vets, they might give you 10 different answers. But we in general recommend at least doing a urinalysis or a dipstick looking for protein because dogs can leak protein into their urine if they have a Lyme nephritis, which is an infection in the kidney. So that's one screening tool we can use, and there's a Quant C6 test that IDEX does, which gives us an antibody level. Again, there's a bit of a gray area with that test. We often base it on clinical signs, though, too, and if the dog's been positive for other things in the past, or any symptoms, maybe recently was really stiff and lethargic and maybe feverish at some point, and things like that. And then we certainly recommend a doxycycline treatment protocol for 28 days. So, and I'm more inclined to treat. If there's any doubt, just treat, because it's an effective antibiotic and the consequences are pretty severe.
Good to know.
So.
I know a lot of people wonder, can the ticks jump from my cat or dog to me, to a human?
So yes, technically that can happen. Especially if your pet sleeps in bed with you, the tick could be just crawling around on their fur, and then hop off into your bed and crawl right on you. I mean, I was horrified. I'll never forget when I first had my first son as a little baby. I found a tick on his ear because he'd been sitting next to the dog on the bed. And that really freaked me out. So it's, no dogs on the bed anymore in my house. But, because you can't, even if you're using good products and everything else, you've got to be safe about your family, certainly. So.
Well, I know that I've had a few tick bites, and I've actually saved my ticks and have brought them to you to take a look at, because I feel like veterinarians see probably more ticks than your general practitioner.
Maybe, but we're pretty good at identifying those ticks.
Is there anything that I've forgotten to ask you about ticks, do you think? Have we covered most of it, or?
I think that's a good basic start. I mean, there's a lot to it, but ultimately, just talk to your vet about what products they recommend. Keep your pet safe for year-round. Both cats and dogs are at risk if they're going outside. And ultimately, you got to keep yourself safe too, so just be diligent about checking your animal and yourself, and just kind of...
I do have a question. If your dog is positive for Lyme, is there a Lyme vaccine? And if your dog tests positive for Lyme, it will always test positive for Lyme, or is that a not truth?
Not necessarily. So they can stay positive for sometimes a year or more. But the trouble is, if you're not monitoring their antibody levels with a Quant C6 test, you don't really know for sure if there's a new infection or if it's an old infection. There is a very good Lyme vaccine. There's a couple of different manufacturers of Lyme vaccines out there. Again, talk to your vet about Lyme vaccination. I highly recommend it. It's only available for dogs, but it's very effective.
So people do not take your dog's Lyme vaccine.
Yeah, I know. But no, it is a very good, effective vaccine, and definitely a good thing to do to protect your dog.
Perfect. Well, thank you so much for taking the time to talk to us. And Baxter, you were a really good dog today. Extra treats for Baxter.
Ooh.
And that's it for our series on fleas and ticks. And we will have another topic soon on Ask the Vet. Feel free to email me, dberenson@me.com, if you have any topics you want covered. Have a great day.